Hey, Facebook fam, it's your girl Joanna, the Soul Stringer here with May Lupus Awareness Month's questions and answers. Today is day 14, I believe, and today we're going to talk about some myths regarding lupus. I thought that that was an important topic to discuss. Lupus is called a cruel mystery because there's still so many things that are unknown regarding lupus. I found some things that were common misconceptions about lupus, and I thought I'd take a few of them and talk about those today. And I wanted to get the ones that were the most common, that were common myths that people think or believe about lupus. The first one is that lupus is contagious. Lupus is absolutely not contagious. It cannot be transmitted from one person to another. It's not a bacteria. It's not a virus. The only way it can be transmitted is from a mother to her baby, and in that instance, it's called neonatal lupus. And in those situations, the baby usually doesn't have lupus long term. Is just is something that's treated and that's dealt with at the time of birth. But in other situations, it's not transmitted. You can't kiss somebody and oh bam, you have lupus, or you can't sleep with somebody and you're transmitted lupus like a sexually transmitted disease. No, it's not the case at all. So lupus is absolutely not contagious like a cold or a bacteria or a virus. Another misconception is that lupus is something that only women get. No, men do in fact get lupus. Children get lupus. Lupus does not discriminate. It's not a disease that only pinpoints women. African American women are more affected by lupus, but it is not a disease that only affects women. Um, Another myth is that lupus is easy to diagnose. It is absolutely not easy to diagnose. In fact, there are some people who still don't have a clear cut diagnosis because it's so difficult. It mimics other diseases. There are over 100 autoimmune diseases with similar character traits. So it's very hard to pinpoint which autoimmune disease it actually is. There's a lot of criteria that's out there now that makes it a little bit easier to distinguish one from another due to certain characteristics, but getting a diagnosis is still very difficult. Not everyone gets a blood test back that definitely says it's lupus. There are some symptoms that are pretty common across the board, but not everybody has those symptoms. So it's still pretty hard to determine whether or not you have a clear cut case of lupus. Is very hard to get a diagnosis. Another myth is that tiredness is in lupus is due to depression. A lot of people think that lupus is something that is in people's heads. It's not really a disease, and that when people are tired, it's because they're depressed. Depression can come along with having a chronic illness, but the symptom of being tired is not something that's synonymous with being depressed or having lupus. They're not one and the same. There again, like I said, there are some people who may have symptoms of depression, and fatigue is something that can be very common when you have an autoimmune disease, but they're not synonymous. They're not one and the same. They're not something that because you're tired, you're automatically depressed. It just doesn't work that way. Fatigue is just something that is common with having an autoimmune disease like lupus, but it doesn't mean you're depressed at all. You're tired. Boom. Another myth is that you don't have to worry about photosensitivity or worry about exposure to the sun. People who have lupus and other autoimmune diseases are highly sensitive to UV rays, whether it comes from lights or from photosensitivity to the sun. You have to be very, very careful about that. You have to protect your skin from the sun. You have to be very conscious of that. You have to wear sunscreen. I don't care what people tell you that you don't have to worry about it. You do have to worry about it. I don't care how darkly complected you are, if you're African American or not, you have to wear sunscreen, and you do have to be concerned about whether or not you're going to burn from the sun. It is just that simple. And not just being lighter complected is going to determine whether or not you're going to be sensitive to the sun. Everyone is when you have an autoimmune disease, and people with lupus are more susceptible to that. So you have to be concerned about that. And probably the last thing that I want to talk about, and the thing that's most important to me, is that people think when you don't have symptoms, it's not important to treat lupus, or if you go into remission or anything like that, that you don't have to treat your disease anymore. Lupus is chronic. If you have lupus, you will always have lupus. Of course, we treat symptoms like pain and fatigue and some of the other comorbidities that we have, whether it be digestive problems, headaches, or acid reflux, or dry eyes, dry mouth, dry skin, whatever. We treat those other symptoms, but when you have lupus, you have to control the disease for the rest of your life. Just because you don't have symptoms of the disease does not mean that you can just go happy-go-lucky, go on with your life. You always, always, always have to manage your disease. I don't care if you're feeling fine and you're feeling great. You have to manage your disease. That is something that has to be managed by a doctor. I don't think most of us as patients have ever gone to medical school and have a degree in rheumatology and can just look at ourselves and know when we're doing great. That is something that needs to be managed by a licensed rheumatologist or internal medicine doctor that specializes in rheumatology or knows enough about our illnesses to be able to determine what we need to do from a medical standpoint. So those are some of the common myths about lupus that I wanted to just go over real quick with you. I know this is a longer video than I normally do, but I thought it was important that we talked about that today. And I'm sure that will more than make up for a couple of days that I've missed. So I'll be back tomorrow to talk about some more things, and hopefully you all are learning from these videos and appreciate these videos, because I'm going to keep doing them whether you do or you don't. So I will be back tomorrow, and I hope you all enjoy your day and your weekend. Peace.